so many people that are struggling in this time period, there's a lot of pressure to do all the things, right? To go to therapy, to go to your acupuncturist, to eat so clean, to meditate all the time, to socialize with friends, to attend all the things. One thing I really like to orient my women that I treat in my practice is really what is missing from sort of the setup and what's serving you, right? There are women that are just doing the mindfulness thing, whatever that means, or working with a dietitian, or picking up a hobby because they were told to do that and it would help distract them instead of what's really serving them. And so asking women to think about other hard times in their life too, where they needed to cope, right, in a certain way, and what served them then. So for some women, they haven't been in therapy in a long time, and now it's really feeling important to have a perinatal specialist who understands the grief and the loss that they're going through. And so we find them a therapist. For some women, I hear about a lot of pain in their body and sadness about their body. And so one thing I really encourage is very gentle movement with someone who also understands and can support that from a safe perspective. I'm a big believer in acupuncture for a lot of reasons. One, because I love alternative medicine as adjunct to a lot of the work that I do with moms, but also I think it's an opportunity to really ask the person to be still with their body, to sort of check in with their body and connect with their body, and shift some of the sadness that our bodies aren't working to understanding and support for our bodies by investing in our bodies with our mind. I really want people to be doing what they want to do, not what they think they should be doing or what they read is gonna work, right? So one thing we also wanna think about is if you're someone who loves the outdoors, great. If you're someone who prefers to watch TV and wants your mind off it, that works too. Really checking in with yourself, and then a little bit of trial and error, right? Like if something isn't serving you and the acupuncture isn't feeling relaxing and grounding, let's get rid of it and try something else. It's kind of a puzzle, Tetris kind of board, to make sure that what you're doing to sort of refuel yourself from a self-care perspective is working. And that's the other piece, right? Self-care can sound so big and scary, and actually I think often like a lot of pressure to do the thing. I really want women to be thinking about how to just fuel up, right? Think about like a car's gas tank. They have to hit the gas station to refuel their tank. So how do you refuel? And sometimes it can be socially, sometimes it's with a partner, sometimes it's alone time reading a book. Check in with yourself and do what works for you. It can be so hard to find any sort of calm amongst the chaos when struggling with fertility issues. One thing I love to introduce, and is a huge part of my practice, is a modality of treatment called DBT, dialectical behavioral therapy. And if you're not familiar, it's a modality of treatment that we use that helps people tolerate extremely challenging feelings that we can't control and we can't change. There is a part of DBT called radical acceptance that I always love to introduce. It's a key concept, and it helps us accept the present moment without trying to change or avoid it. Now, often I know women are like, well, that's easier said than done, and I don't like what I'm going through. And you're right. Part of radical acceptance is actually understanding that it's not that we have to like it, what we're going through, but if we have any kind of willingness to embrace the fact that we can tolerate painful emotions, that we don't want to change it. I always say we don't want people to suffer, but pain is a natural process of life. And so getting more comfortable with pain and learning how to acknowledge it, give permission for the feelings, and let go of them is such an important skill that will also help you throughout becoming a parent. Another piece of the radical acceptance that's really important are these mantras that we can use, right? So saying things to ourselves and to anyone around us like, this is temporary. I can cope with this. I've accomplished hard things before. I can do this again, is a really grounding way to remind our body and our mind that we can get through hard things. I know during this time period, there's all this resistance and desire to hold on for control, to organize ourselves, to feel like you can work harder at this to make it work. I really want women to accept that the minute we can pause, slow down, and accept that we're gonna get through something that needs its own time. It is absolutely a myth that your anxiety will change the outcome of your fertility. However, one thing we do know is women that are going through fertility challenges are much more likely to struggle with stress, anxiety, and depression. One of the things that actually can combat some of the stress and anxiety that we see so many women experience is social support and group support. Often it's not with your best friend who maybe already has 2 children running around, because that can be extremely triggering. So finding people in your stage of life in this season that are going through that challenge is so important to restore your mental health. I believe in nothing being more helpful than being around others who have been in your shoes, who understand what you're going through, who have been in the same chair in a doctor's office, who are experiencing the same realities as you. Please look to find community, whether that's at Dandi, whether it's a social support group outside. It can be extremely helpful to lean on other women who just truly get it and have walked in your shoes. Hang in there, you've got this, and please reach out for help if you don't know where to start. You can find me on my website with elizabethb.com and on Instagram at the same handle. Check out dandifertility.com for more resources too.